Hey guys, welcome to my channel. This is your pharmacist Khan. I'm just gonna introduce myself. I got holding a bachelor degree from pharmacy, which is from basically Usmania University, and I got an active what I can say, got an active pharmaceutical license from the Telangana Pharmaceutical Council of India. My motto behind creating this channel is to give you the exact formulation along with the substitutes, like a number of substitutes you're gonna get it in upcoming videos of a single component or of a single drug in different formulation. And apart from formulation, you're gonna get it in moreover, we are focusing on cost effective drugs which are present currently in Indian pharma. Apart from generic and monopoly, my motto is to deliver you the ethical drugs, which is known as basically the patent drug, what we can say. So today's topic, without wasting a single time, let's dive into today's topic. We are many of us come across what I can say, paracetamol drug, which is known as in like micro laboratories, you have a name of drugs called as so-called like dolo 650, which is got very famous in during COVID pandemic, which is used as an antipyretic drug along with an anti-inflammatory action. Basically, let me give you the introduction about this sort of this category of drugs, which comes from poor analgesic and anti-inflammatory action. This let me have a small glance of this. Basically, this drugs is an para-aminophenol derivative drugs, which is also known as like acetaminophen. This drug generally costs you what I can say adverse effects, which is in my very minute. What I can say just cause you like this drugs, if you take it, it makes you like nauseous, and sometimes you may vomit, and along with that long term usage you may get constipation and itching of the drug. Some people are like very much allergic to paracetamol, by in which cases you need to like go and consult a doctor too. And insomnia, which is in rare cases you're gonna get like insomnia, which is difficult in sleeping, and headaches too, depends on like if you're like sometimes you may get liver diseases, very really severe liver diseases too. So let's stay connected. Let's dive into the topic. What basically I'm gonna discuss you with is it should be taken like Doro 650 is like a 650 mg, obviously, which is near to gram 1 gram. So basically, it's in like higher doses. If you're gonna take it, paracetamol, it acts as an anti-inflammatory drugs. In lower doses, it acts as like antipyretic drugs, which is known as pyretic, means like the temperature controlling drug. Um, Apart from that, Dolo 650, which is a micro laboratory drug. Apart from that, you will get it in different brands, which I'm gonna show you at the end of the video what all like different drugs and how it looks like. You will get it in Apex Laboratory too. That's named as P125, P250, and P650 and P1002, which is like 1% cheaper than compared to macro laboratories. And then you'll get it in Abbott laboratories, which is known as Meridian 650, Meridian's 500, and Meridian's 250 also, which is like 30% cheaper than micro laboratories and Apex laboratories. And you will get it in IPCA laboratories also, which is known as Pasimol, which is like 6% lesser than comparatively from Dolo 650. And Colpoldo, which is Galaxis, which is also like same 6%. And Paragesic, it's India company, which is like 32%, and they have like around cutoff of price effective in that. And apart from and I would like to like have a give you the extended release form, which probably more effective. I mean, my father's when like elderly patient, what I can say, father when he's like suffering during COVID, he's suffering from high fever, and my family physician has prescribed it thrice a day. So basically, it's become around like 1200 to 1300, 1350 mg of drug. And with my experience, I have gave him like around Lalon, which is known as like extended release form of drug. With that, he immediately he got a control.